VATV, Vietnamese American Arizona Television. Hello, everyone. Welcome back to VATV Healthcare Today program. Today, we are diving into a topic that affects a staggering number of us: low back pain. Did you know that up to 84% of adults will experience low back pain at some point in their life? Yes, that common, and it's one of the leading reason people visit doctor and miss work. In any given year, approximately 23% of adults suffering from low back pain. And it's not just a brief inconvenience for many. For those who develop chronic condition, this pain can persist for 12 weeks or more, deeply impact quality of life. Despite its prevalence, many people are not aware of the risk factor or how they can effectively manage or potentially prevent this pain. But why should we talk about it? Because knowledge and power. By discussing the etiologies and preventive measure, we can potentially reduce the number of people who suffer from this debilitating condition. Most cases of low back pain are not due to serious condition and can improve with non-pharmacological treatment like physical therapy, heat, and exercise. Yes, it's crucial to address and not underestimate this pain, as less than 1% of cases are linked to serious condition like metastatic cancer or infection that require immediate and intensive care. Today, we have Dr. Tran, who will help us understand the importance of early detection and appropriate management can prevent further complication and aid in the quicker recovery. Hello, Dr. Tu Tran. How are you doing?
Yes, good evening. Good evening, Linh. Good evening, everyone in VAATV, Arizona. Yes, as you know, I'm an internist, gastroenterologist, practice here in California. As Linh mentioned, yes, low back pain is very common. Yes, up to about 84% of the adults will have this back pain one way at one time or another in their adult life. And fortunately, most of these cases are self-limited, which means that it will improve with time, right? And there's about 10 to 30% of the people will develop into a chronic condition. And these are the patients that we need to focus on, how to prevent recurrence. Unfortunately, whatever we do, just overall view is that the symptoms can always come back, but you need to be very efficient in terms of your prevention. Then hopefully it will improve your symptoms or your pain as we speak. Okay, so I know there are a lot of questions, so I will let Linh to proceed.
Yeah. Okay. So last time when we have the first talk show with Dr. Tran, then we have one of the viewer was questioning about
That's
the low
right.
back pain. That's why we have this topic.
Yes, I know. I read that, and it's he has visited so many doctors, 6 doctors, I believe, and the symptoms seem not to go away. But specifically for that patient, I just want to understand a little bit, like if they have done any X-ray, if there is any etiology like spinal stenosis or any arthritis or anything like that that can cause it. Because of those kind of etiology, the symptoms will not go away 100%. Therefore, he may need to do other things to help with the pain, besides taking Motrin, Tylenol, etc. Hopefully, this information that we are presenting today give a little bit clearer picture so that anybody who can listen to it can proceed with some prevention therapy that they can have.
Yeah. So you can tell us what are some risk factors associated with the low back pain?
Well, risk factors are many. Obviously, aging is one. As we get older, we tend to have back pain. Could be just because of the wear and tear, the arthritis, that kind of thing. In terms of sex, Female tend to have a little bit more than male. There are several reasons for that. For example, during their childbirth ages, they have to carry the baby inside for 9 months. That
Yes.
put a lot of strenuous work on the spine, and so chronically it may develop that pain as well.
Mm,
As you get older to menopause, then up to about 20% the bone
mm,
will be reduced, and so the density will be reduced, more risk of osteoporosis, and that can cause back pain. Other things, obesity, gaining weight, your
yeah.
back had to carry a lot of extra weight that can induce that risk of having back pain. What a lot of people may not know is that
Mm,
there are multiple studies show that smoking linked to low back pain. Why? Because overall, for example, smoking is very bad for you. It destroys the arteries and all that stuff. So the arteries, the blood that go into the joints and all that stuff has been damaged, and so that can cause injury to that. Furthermore, smoking also link osteoporosis, and so
mm,
if you have a bone problem, then
mm,
that will also increase the risk of back pain. Now, psychologically,
mm,
people might not know anxiety, depression they are also linked to having low back pain. Why? Because I think the reason is that this patient tend to have very high sensitivity to pain.
mm,
Some have headaches, sometimes fatigue, their body is aching, and low back pain is one of them. And so there are multiple, risk factors. If you have one of that, then we need to work around it to see if the risk factors can be resolved so that your back pain may not be there in the future.
mm. So, do you think like what is the most common cause of the low back pain seen in the primary care?
Well, depending on the age, but in overall general population, like for example, from 18 to 50 years of age,
Mm,
the majority is non-specific. I mean, there's no etiology. It could,
okay.
most of the time, they would figure it's muscular
Mm,
skeletal, mean your muscle, the straining pain, that kind of thing. But there's no obvious etiologies like arthritis or stenosis or anything like that. So the majority of it is very non-specific. There is no there's no etiology of it. Most of that patients tend to get better within 1 to 7 weeks or 2 months.
mm,
With time, especially with some medication, Tylenol, etc. But yeah, the other percentage tend to link to some kind of arthritis or infections. Even the small percentage to cancer.
mm.
We can talk about that later.
Yeah, right. So, if how can we distinguish like chronic and acute? The
Well,
like you
yeah,
say.
when we talk about chronic and acute,
Mm,
it depending on the time. So if
okay.
the patient has pain within 1 month, then we call it acute. And regardless of what they do, regardless of what therapy they take, if the pain go further beyond 1 month, and
Mm,
then we name it as subacute.
mm,
That is, it will last all the way up to 1 year. But if the
oh,
pain persists more than 1 year to lifetime, then it can what we call chronic.
chronic.
If it's more than 1 year, yeah.
Mm,
So
I
it's based on the time present of that pain as well.
So, based on what you say, is like every time when there's pain, you take painkiller. It's just the coverage, but it's not really the find out the reason, the symptom, right? Is that like what
Yeah,
kind of?
most of the time, right? Because nowadays in the medical field, when the patient present with the pain, you
Mm,
tend to allow conservative treatment first. You don't go right away into X-ray. You don't go right away to find out, especially in young population.
mm,
A lot of people who works outside come back with back pain.
mm,
They know that it's more musculoskeletal than anything else, nothing serious. So they don't want you to have all that test done to find out. So obviously, relax. Be careful of what you do, the activity that you do that aggravate the pain, or some Tylenol or ibuprofen.
mm,
Then eventually it will go away. And so, yes,
Maybe
only
like you.
those.
Mhm. Yeah,
Yeah.
sorry. So then probably like you can show us some of the kind of exercise before we perform any kind of heavy duty or anything, like so that it can like a warming up of your muscle
Mm,
or something, so that it
right.
won't lead to the pain.
Well, for example,
Mhm.
in acute setting, in
Yeah.
acute, which means that if the pain is within 1 month,
Mhm.
usually they don't want you to do any kind of exercise.
Oh, okay.
They want you to relax and be careful of what kind of activity that aggravated more. But
Mhm.
most important is that they do want you to get up and walk. They want you to be active, but not actual exercise to really stretch or anything like that for that pain, because sometimes it might aggravate it more. The inflammation is still there. That's
Mhm.
why you need to limit on the activity part.
Mhm.
But you cannot just sit there day in and day out. That will make it worse. And so the guideline is for you to, if you can, get up and try to be active, walk around.
Okay.
Pain medications like regularly, that is treatment number one, either ibuprofen.
Mhm.
Remember to take it after meals or have something to eat first before you take it because of the side effect. Or
Mhm.
Tylenol. Tylenol is also a good thing, but compared to ibuprofen, Tylenol is not that good compared to it. So I would prefer ibuprofen with meals, limited activities during the acute phase. Now, if the pain go beyond that into chronic phase, that you continue to have that, then the exercise prevention, you can have some acupuncture therapy, you can have all that. I will show certain
You
exercise
have
that can help
okay.
you as well.
So is there the diagram of the exercise? Can you please show up for us, please? Yeah,
Yeah, so if we can have page 5.
page 5. Okay,
Okay, wait, okay, back to 4. If
back
you
to
can
4.
see, yeah, back to 4. Now,
Yeah.
these ones are good in terms of subacute, which mean more than 1 month, all the way to 1 year. And after 1 year, you can do that. As you can see, you have certain, these kind of gesture is to stretch out your back. There are butterfly pose, there are bridge pose, there's a cat pose. I mean, they have names for it, but uh, basically it is to stretch your lumbar
Mhm.
spine. Okay, so as you can see, hopefully, I mean, they have that on the internet. You
Okay.
can see the next page.
Yeah.
Next page.
Page 5, please. Next. Yeah.
There we go. The next page is also very similar. Again, they're trying to, stretch out your back. And so you do this every day. That will help stretch out your back, relaxing your muscles on the lower back muscle, build up the strength. Hopefully that will improve. Now, the last page is the page that I like most. That's
Oh,
the
yeah.
one. Okay. I mean, even I have back
Yoga.
pain, and this is the one that helps me the most. Is that even when in acute phase, this is not an exercise. It's just like a yoga gesture. Okay. If you just do this first on the right side, and then you switch to the left side, your pain on your lower back goes away right away after that. You don't have to do much. You just have to focus on about, I would say, 15 to 30 seconds each side. And then when you get up, you will feel better right away. And so if you continue to do this every day, then it will help in terms of your pain. It doesn't cause too much pain. It just help it right away. So that is my best position that I like to
Is
do.
that up to the left and to the right too, right? Like first,
That's
like
right. That's right. But
right.
you have to do if you reach the hand, the
Uh-huh.
right hand up, then your
Uh-huh.
left leg. So the opposite.
Okay.
The left
Okay.
leg will be
Opposite of
up.
the hand and the
You're
leg.
right.
Uh-huh.
Right. So the opposite of the hand and the leg. And you do and pose and stay like that for about 15 to 30 seconds. And then after that done, then you switch the different position. So the left hand down and the right legs down, and just alternate. And you will find right away. I mean, do it now, and then you will feel your back pain feel improvement just like that.
Oh yeah, that's a
Unfortunately,
great.
yeah. And unfortunately, it does not
Lie.
resolve the etiology. It just helps you in terms of pain control.
Okay. So do you know like what percentage of the patient that come in to see doctor for low back pain for medication? Like,
By studies, it
yeah.
shows only about a third. I mean,
Ah,
only about 30%, 33% of the people that go along with the study that they found, and that about 10 to 30% of the people who have pain, acute pain, would develop into chronic pain. And so
no.
people who come in afterward, a third of it, which is about 30% as well, is that because when they first have pain, they don't go to the hospital ER right away. They
Mhm.
do it on their own. They put heat therapy, they put cold therapy, they try all that. And then
So low
once they
back.
keep on going beyond 30 days, they say, you know what, I might need to see a doctor. And that's when that 30% showed up. And it kind of coincide with that study. So only about a third of the patient group that go into, for help.
Yeah, because I think everybody afraid to go see doctor for anything
Well,
serious.
for one thing, they might, I mean, they're afraid that they might find something more serious.
Yeah.
And just to let you know, is that by studies,
Mhm.
only less than 1% has a very serious etiology. For example, like cancer or
Cancer. Yeah.
metastases or anything like that. But then
Yeah.
you need to look at the red flags. You need to find out if there are other things that may make you think that you need X-ray and all that stuff.
So we're talking about that um,
Red
cancer.
flags?
Yeah, about
Yeah.
that cancer things like what you say 1% that lead to, but of course we
Mm-hmm.
need to know that 1% too, because sometimes we let go, we ignore, and then take painkiller for the pain keep come back and forth, then there might be something serious, right? So you can
Yeah.
explain to us what are the like anything involved with the bone, low back pain.
Yeah. I mean, if we talk about the
Like low,
serious etiology,
yeah,
like the one that you need to worry most, well, obviously, as a doctor, you're gonna have to figure it out whether or not which one is more important. One of the things that we need to do is the history, whether or not the patient has history of cancer before or not. So if
yeah.
the patient has history of cancer, number one thing that you would think about is metastases or the recurrent of cancer that go to the bone. Other things, for example, if there is any fever or chill or fatigue, any systemic symptoms that go along with the pain. You think about infection that can cause it. If you examine the lower back, whether or not it's very tender, is it very hot or not. If it's feverish and hot and tender and swollen, then you worry about infection or abscess in that area. So
Mhm,
obviously you need to take x-ray right away.
mhm,
Things, for example, if you have other thing, not specifically to the bone that can cause pain. For
mhm,
example, if you have some patients that we have, for example, gastric cancer, stomach cancer, or anything like that. I mean, if you have related unexplained weight loss,
mhm,
or any other sign like GI bleed, see blood in the in the stool and lower back pain and all that, then you have to worry about if there is any other kind of cancer or diseases not related to the bone, but it also has similar effect of pain to the lower back.
mhm,
Other things that you look at is if you have numbness to your feet, if you have involvement to your bladder, to your intestine, fecal incontinence, urinary incontinence, those related to the nerve stimulation. And so if you have problem with that, if you have, for example, like spinal stenosis or something that compressed the spinal cord, then it affects the bladder. It doesn't control, the function is limited. And
mhm.
so if you have those kind of symptoms, then yes, you need to have x-ray done to find out for sure if there is a cause that is more serious than you think. So less than 1%, that is if you need to look at for the red flags. If you have history of cancer, if you have history of infections before, that kind of thing. And so we have to, be wide open in terms of that. As the patient, you need to know that as well. Is that, hey, if I have cancer in the past, sometimes it may come back or it may metastasize there. So don't take that too lightly of your back pain, things like that.
So you mentioned numb. Okay, is that
Mm-hmm.
different like cramp, right? When like you lay down and you woke up and then you feel cramp, and then the numb. What is that
No,
associated?
cramp and numbness are two different things. For example, when it affects the spinal cord, a spinal nerve, then the numbness is the sensation that you won't feel anything,
Okay.
and usually it's long. Whereas the cramp means spasm. Your muscle cramped up, spasm, and that's it. And then a little bit of tingling sensation afterward, and then it comes back to normal. Usually it does not cause by that. And
Uh,
so it's a temporary problem only. But in terms of the numbness,
mhm.
the motor is weaker, like your legs all of a sudden feel weak. You cannot control your bladder or your stool, for example. And those are neurological deficit that you have to think about if there is something more serious in terms of your back pain.
I see. So there's a question like, what are some non-pharmacology therapy for low back pain, like no drinking medication? So you already mentioned earlier about that exercise, right? Um,
Well, exercise is one.
okay.
For example, exercise, you usually do it after the acute phase, meaning that
Okay.
after 1 month or so, or even chronically, then you can use that. The study showed that it gives some benefit of exercising to prevent recurrence of the back pain. Now, the one in terms of the acute, I mentioned already, is that the guideline, they just want you to be just active, very limited in terms of the activity. There are certain things that you try to stay away from, otherwise it may aggravate it more. For example, if you have back pain and you still carry heavy stuff in your hand and press it down on your spinal cord, obviously that's going to get worse. So you have to, stay away from that. But do walk around, keep yourself active so that, your joint moves a little bit, helps your inflammation to get better before you start the exercising. So exercising is helping in terms of the subacute and chronic. Other things they can do, like for example, patient would say, okay, it hurts so bad, so they're going to put heat pad on.
Mhm.
Or some people would say, oh, I'm going to put a cold therapy on. I mean, the rationale is that if you put the heat on, that you may reduce the muscle spasm. It can help, but it's only on the superficial only. It doesn't penetrate down to the bone itself, and so it may help the patient to feel better.
Mhm.
But in terms of the etiology, whether or not it will resolve or not, it doesn't. By studies, it doesn't show any benefit. But for the patient satisfaction, heat therapy can do it.
Mhm.
Massage, a little bit massage in that area to help feel good a little bit.
Mhm.
That can do it. Cold therapy, like I mentioned,
Mhm.
that can do it. Those are the one that you can try during the acute, but it won't give deep benefit to it. In terms of the chronic, you can do the same. You can do more times. It also helps, but again, it doesn't help resolve the etiology of that pain. Okay. In terms of the chronic, you can also do spinal manipulation.
Mhm.
For example, chiropractor, physical therapist, again, only on chronic. Okay, so they can try to adjust your bone, your joint, and all that stuff. Uh, Unfortunately, it will not resolve it. It only makes you feel better in a short period of time, and
Yeah.
then within a few hours later, you start feeling the same. And so, you can do it, but knowing that is not going to resolve what caused the pain. I have some pictures in terms of the traction. The
Okay.
tractions again, yeah, the traction again can
Is that the
also
first
help
one?
in
Page one.
chronic. Yeah, the
Uh,
first one, and yeah, page one and page
Page
two.
one and page two.
So yeah, page one first. Um, no,
Page one. Yeah.
okay, there. As you can see, there is, what you would call the back brace right there. And if the back pain is in the lower area, the brace is on. If you put it tightly, what it does is that it helps pull up the spinal cord up a
Mm-hmm.
little bit, kind of release the tension,
Mm-hmm.
especially when you walking.
Mm-hmm.
That will help because if you stand a lot, you put your spinal cord has to stand upright. Everything is by gravity pushed down. So if you wear the braces, it will help not to press down on your lower back so much. So if you go into page two,
Mm-hmm.
this is I like the most. Why? Because I have worn so many back braces, and this
Oh,
included. This is
oh,
the one that I stick by. The
what's a little
reason
stick
is,
next to it? What's that?
well, no, that one is the pump.
Oh,
As you can see, without pumping, it's very
uh-huh.
short, right? It's very
Ah,
short.
oh,
Okay, and
okay.
then you put it in your, you put it in
Yeah.
your waist,
Uh-huh.
and then you pump it up. Once
Ah,
you pump it up, as it
yeah.
stretches out, the length is a little bit longer. And see,
Ah,
and
okay.
so what it does is that it also pushes the spine upward, so kind of spread out, so it doesn't touch, the nerves or anything like that. Just be careful. Don't pump too much because if you pump too much, it might pop and ruin the whole braces. Okay,
Ah,
but just
okay.
enough. Yeah, just enough that you can feel it stretch out right away. And
Ah,
as
okay.
you walk with this, oh my
Uh-huh.
God, your pain is
It's
improved.
gone.
Uh,
Oh, that's
that's right.
nice.
And
Oh,
so I'm speaking for experience because
oh, yeah.
I have gone through so many braces and I
Uh-huh.
end up with this one, and I'm still wearing that. Even when I exercise by walking 5 miles, I wore that. And
So
afterward,
where did they find that? Where can they find that?
oh, it's on Amazon. If you look
Oh,
in
okay.
Amazon,
It's just like
Amazon,
the
they have
pump
it.
one, right? Like they can ask for the
Yeah,
braces with
yeah,
pump.
yeah. Because I do have the other one with the bar that
Mhm.
kind of when you put it tightly,
Yeah.
it does stretch out a little bit. That will help works.
Mm,
But with the pump, I feel like it's you can feel the stretch as you pump in the air, and that's why maybe it's just my imagination.
mm,
But I found that very helpful to me. And as I walk, I do feel that it helped my upper not pressing
mm,
down to my back so
mm.
much, and so it helps me with the pain. Okay.
So
There's another thing that we try that a lot of people try in terms of traction. If you go into page three,
okay.
this is a small device. Page three, this is a
Yeah.
very small device.
Mm-hmm.
This is also to stretch out your spine as well.
Fine. Oh,
And yeah, and I do have that. To be honest with
you have
you,
everything.
uh, I mean, come on, lower back pain.
Yeah.
That's my area.
Yeah.
So anyway,
That's
what
true.
it does is that it stretch out your back. You
Uh-huh.
only have to lie there for about 5 minutes. Okay,
Okay.
5 minutes on a daily basis, and it helps you with that. First of all, people may not enjoy it too much
Yeah.
because when after that 5 minutes, even though it stretch out, you feel very painful of moving it.
Oh,
But then try to be careful getting up, and then day in and day out afterward you get used to it, and then all of a sudden your pain will improve gradually. But you have to continue to use it because if you keep on stretching it out, hopefully the edema, the inflammation will
mm.
resolve, and the spine will separate it by itself, and so it doesn't touch your cords too much. And so it does help. I do have that too.
So another question, like for
Mm.
whoever that sit a long time, like for driving, uh,
Mm-hmm.
whenever the passenger, I'm saying, not the
Mm-hmm.
driver, okay. So
Mm.
when the person sit too long in the car, then when she wake up, she feel numb on her feet. What should what I mean, what prevention and how can she get that go away?
Well, it depends on how she sit.
Okay. So the
cross leg
posture.
or something like that. Anything that might interfere with one nerve or another, that can do it. Another thing is the vessel, the arteries, and all that stuff. For example,
Mm,
depending on how you lie down, you pinch on that arteries, and the blood vessels doesn't flow down smoothly, and so it can cause cramp. It can cause numbness. All she has to do, I mean, to prevent it is just to loosen up, mean that sit it, don't cramp. Sit it with the leg, spread out so that the circulation is there. Also, don't sit too long. Obviously, if you're driving as a passenger,
mhm,
hopefully get out every hour or two, walk
mhm.
around a little bit, get the circulation going from the legs all the way up. That will prevent it. But the one that tend to be more cramped, the legs is more curled up, and it pinch on your artery, your nerves, and all that. That can cause it. And so the more stretching, the better. The more leg length that you don't have to cramp up is also better. That will prevent that kind of problem.
So can it cause anything seriously if like the person want to reach out to the destination and keep going and not stopping for a long time? Will
Well,
that
yeah, I mean, if you there are certain people who may have problems in terms of developing what we call blood clot. Like
mm,
if you sit too long and there's no circulations,
yes.
depending on what the arteries, what the vein is being kinked, and if your clot is more than others, and
Yeah.
then a blood clot is developed in the legs, and so you start having swelling of the leg, pain in the leg. Yeah, that's going to be more problem. So that's why for those people, you need to wear stocking
Oh,
for their feet, or
oh.
like I said, get up and walk around, exercise, so that it will help with the circulation. But if you persist on sitting and sitting, and if you have the risk of having clots like that, then
Mhm.
yes, it can go into a serious problem. So just be careful.
So another question: what is the role of imaging in diagnose low back pain?
Well,
Can you?
like I said, imaging like X-ray and all that
Yeah,
stuff.
X-ray.
Usually,
Is that
yeah,
a good
the
role?
right, the guideline, like I said, for the acute phase, most
Yeah.
of the time you do not need X-ray. I mean,
Okay.
if you go to see the doctor, if you have pain within 1 or 2 weeks, they
Mhm,
probably say, okay, limited your activity, take Motrin, do a little stretch and all that stuff. That's what you do and see if that will improve.
mhm.
So X-ray in the beginning is not that important.
Okay.
However, like we mentioned about the red flags, I mean,
Mhm,
if you have history of cancer, if you have history of infection before, if you have other kind of systemic symptoms like I have a fever, I have chill, I have weight loss, and all that stuff, make you think about other etiology, then
mhm,
they would do the X-ray. But most of the time, like I mentioned, all the way up to 80, 90% of the time, you don't need anything at all. No X-ray, just conservative treatment,
mhm,
limited in terms of your activities. Takes the Motrin or Tylenol
mhm,
and allow your body to improve with time.
mhm.
Inflammation will go away. Unless if more than 30 days go into a subacute and your symptoms still persist, and you start having those kind of red flag symptoms,
Mhm.
then they go ahead and do the X-ray.
No X-ray. I see.
Yeah.
So to you, is like the symptom that come back and forth at the same area many
hmm
times. Then it's called
hmm
chronic. Is that
Yeah.
what you call
Well,
chronic? Yeah.
no, chronic
Oh,
mean, but they go by time. Mean that if it's
okay.
more than a year, if you have this pain for 1 year, at least
Okay.
1 year, then
Uh-huh.
it's chronic.
Oh,
From 1 month to a year, they call it subacute.
subacute. Okay.
Yeah, subacute. But in those time, you can also do X-ray if it doesn't seem to improve from the acute phase.
Okay. So there's a prevention for the acute any the therapy for the acute pain, low back
Well,
pain.
in terms of treatment, like I mentioned before, is first is the Motrin, ibuprofen,
Okay.
anything for pain for anti-inflammatory, right?
Okay.
So ibuprofen is good. Tylenol is also good, but remember the ibuprofen you have to take it with meals so
Mhm.
that it doesn't cause problem to your stomach, etc. Tylenol will be okay. If pain doesn't seem to improve with those medications, then they can also give something a little bit stronger, like opioids or tramadol. But obviously, the stronger the medication, the more side effect you have. So, you have to be careful with that. Some other medication that can also give that may also help, like anti-seizure, things like that. But also muscle relaxant is also another one. If ibuprofen and Tylenol doesn't seem to help, they had to go hand in hand together. But again, with muscle relaxant, it does come with side effect, and so you have to be very careful, especially in the elderly. The side effect, for example, sleepy, drowsiness, that kind of thing. So yeah, you just have to be very careful.
I see. So, okay, so before we end the show, can you please repeat all the prevention for the
Mhm.
acute and in the short term for prevent for not having that low back pain, as much as possible.
Well, yeah, as much as possible in terms of prevention. Prevention, you can do daily exercise, stretching. And if you look online, just type in lower back pain exercise, they will show you certain technique, or even YouTube, they show you how to do it. Most of that exercise, their aim is to stretch out and relaxing your back or build up the strength of your back. If you're able to do that every day, and then your pain will be controlled, and eventually it will go away. Unfortunately, there are also a lot percentage, like up to 50%. It can always recur and it can always prolong. That's one thing, depending on the etiology of it. That's one way. Number two, acupuncture found to have some benefit. So, if you have any chance to do that, that'll be good. Chiropractic maneuver or physical therapist. I mean, they say that it may improve, but only temporarily. That helps you on that day, but it will not go away. The pain will not go away. You cannot prevent that.
Okay.
In terms of the traction,
Mm.
the spinal support, the one that we show you,
Yeah.
again, it helps stretch out. It helps lessen the pain, especially when if you stand up all the time or you sit all the time and your spine is constantly hitting each other, the pressure, more burden on your spine. With that support, it will stretch out and help with the burden, and so your pain will improve a little bit. And so if you're able to do that, and number two things, for example, obesity mean if you gain weight, try to lose weight. That's
Oh,
that's
okay.
one of the better thing, because if you have extra pound
Uh-huh.
on your spine that need to be carried, that will make it worse. So if you lose weight, that also help. And smoking. And
Uh-huh.
see, I mean, smoking can do wonders, if you stop. Not only to help you in terms of the arteries to your back and all that stuff, but also your heart, your lungs as well. And so those are the, two things that I think
That, that's one
important
thing.
overall.
So that's one thing important is that as the bed, the mattress will also a, a big portion about helping not having a back pain.
So,
Thing.
well, in terms of the mattress, some people may feel that it's better,
Yeah.
but overall, there doesn't show any benefit to it.
Mm.
However, what I found out is that when you lie down, make sure you have a pillow underneath your thigh. So,
Uh,
which means that you lying down with your legs lift up a little bit like that.
uh,
That what that does is that it stretch out your lower back, and so when you get up in the morning, you
mhm.
don't feel as painful like before. And
Okay.
so that also helps in terms of that. Uh, but otherwise, yes, if you do that every day, hopefully your pain will be somewhat lessened, a little bit better control, and your daily life will be a little bit more to look forward to.
Mhm.
Otherwise you get up, you have pain everywhere, and you say, you know what kind of life with this kind of chronic pain like that?
We don't want that. Yes.
No, no.
Right. We don't.
Unfortunately, as we age, we will all have to face it one way
Yeah.
or another.
Or
Yeah.
young still have back pain too. Young or
I
old.
know, I know. A lot of young people tend to have it now, but there are other some issues. A
Yeah,
lot of young people has more psychological problem
yeah,
like
yeah. That's right.
anxiety. Yeah, anxiety, stress, depression, things like that can
Or
play a
cancer,
role.
right?
So,
Mhm.
yeah, so you just have to be careful.
Mhm. Okay, well, thank you for joining us today episode of Healthcare Today. We appreciate you tuning in and following along with our discussion. Remember, your feedback and questions are valuable to us. If you have specific healthcare question or topic you'd like to cover in the future episode, don't hesitate to reach out to Linvi at vaatv.com at gmail.com. Until next time, take care of yourself and your family. Thank you, Dr. Tran, and see you next time.
Thank you, Lindsay. Thank you, everybody. Bye bye.
Xin cảm ơn sự theo dõi của tất cả quý vị trong những giây phút vừa qua. Chương trình VAATV xin kính chào, tạm biệt và xin hẹn gặp lại quý vị vào lần phát hình kỳ tới. Mọi chi tiết về thông tin thương mại và bảo trợ, xin mời quý vị hãy liên lạc về địa chỉ email vaatelevision@gmail.com và số điện thoại là 480 289 9816 480 289 9816, website vaatv.com và vaaznews.com. Xin kính chào, tạm biệt.